harm than good.
Harold?
Good morning, David. Looking at these, Harold Ford, looking at the numbers here, and the question you asked of Joe about answers from Republicans, I think you're right. They need an alternative. But the reality is this is our plan. We own it, and this was an answer we had to the growing health care cost problem in the country. What recommendations do you have, and which are you sharing with the administration about how to deal with this? Not just these numbers, but making this program work.
Right, Harold. Well, I did ask that question because we hear a lot of talk about repeal, but we don't hear about replace anymore. So here's the reality of the health care plan, okay? 3.1 million people under 26 have insurance now who didn't have it before this law. 17 million kids with pre-existing conditions can no longer be excluded from their family insurance because of this law, like my child would have been back in the day. 105 million Americans can no longer be thrown off their insurance because of lifetime caps when they get seriously ill. 8.5 million Americans have gotten rebate checks because their insurance companies were spending too much money on executive bonuses and administrative costs and not enough on health care. That is the reality of the Affordable Care Act. And by the way, in terms of costs, we've had the lowest period of increases, or the slowest rate of increase in costs, as the CEA said yesterday. Since the 60s. So my advice would be to emphasize these stories. All over this country there are people who are being helped today, including the 500,000 who have gotten insurance since October 1st because of this plan. That is what should be emphasized. There's a whole other story out there.
We've got some
David, let me just ask you, we talked last week, or maybe it was Tuesday, my days are blurring, but there's a compelling case to be made on which everyone can connect, and that's about wanting health security for their children, especially children with pre-existing conditions. But that was never the debate that was had. That was never the conversation that President Obama had. Instead, it became very partisan very quickly. And I wonder if there's any remorse on the part of the White House that they didn't slow this down, that they didn't try to bring along some Republicans who would give them an extraordinary amount of much-needed cover at this hour.
Nicole, you were sensibly out of Washington and working on novels and stuff when some of this was going on. But I was there. I was in the White House. I was there when Republican senators came in for hours at a time and sat with the president. One senator, senior senator who had voted for a similar plan in the past, or had supported a similar plan in the past, met with the president. They agreed on almost everything. The president said, well, we agree on almost everything. Can you support this? He says, well, not unless you get 10 other Republicans, because, the policy is not to support this. So if it was partisanized, don't lay that all on the president. The fact is that the Republican Party, as Senator McConnell said, had a policy that they didn't want to work with the president on any major bill, because that would connote, as he said, that he had figured things out. And so, I do regret that. We spent 6 months trying to get Republican support on the bill. We ran into a blockade on that. But as between that and having a law that protects the American people, that gives people health care who don't have it, that holds down the cost of health care and the growth of health care, I'm glad that he moved forward.
Miles?
David, I'm in the marketing and advertising business. The president...
I used to be. Yeah.
And the president had great success using the internet, using social media. So the president's office is very sophisticated technologically. The feedback in the marketing services community is, why wasn't there proper preparation to deal with the onslaught of demand that was going to come through the website, to organize it, to deal with that in advance, and to delay the implementation till the infrastructure and technology was in place and proved to be foolproof before you push the button? Because, as Will Rogers said, you never get a second chance to make a first impression. The problem is that even if the fundamentals of the plan are good, if you can't access it, your impression is extremely negative, and it makes you ill prepared to deal with how to navigate a website that's not proper. Why wasn't it tested in advance? Why didn't it delay it?
Listen, Miles, no argument here. Listen, as someone who was there and fought very hard to get this law passed, I'm as outraged as anybody about how this thing rolled out. And I think you ask very good questions, but the fact is, looking back doesn't get you very much. You have to look forward now, and it seems to me, and from everything I hear, the LA Times wrote about it this week, things are improving day by day. More and more people are signing up. Remember that in Massachusetts, where they had some problems but not these big problems, 123 people signed up for that health care plan after Governor Romney passed it. 123 people in the first month, and it gained momentum. And when the deadline was arriving, there was a big rush of people. I think you're going to see the same thing here.
All right.